Remarks, and right now I'm happy to give the floor our first speaker, who is Olga Kiseleva, who will be speaking about glaucoma risk factors and who will emphasize which of them are priorities for this particular disease. Thank you. The floor is yours. In fact, dear Presidium, dear colleagues, in fact, speaking about priorities of particular risk factors in the pathogenesis of glaucoma is very difficult. That is why let me comment briefly on all the risk factors and which of them to be selected. It's our decision. So, glaucoma is a very socially significant disease, not only in Russia, but also all over the world, because it takes the leading position from the reasons of irreversible blindness. Disability because of glaucoma is presented here. From employed population, it's 10 to 9%. From the died people, it's more than 40%. Glaucoma, it's a multifactorial disease with particular threshold effect. That means that there is particular primary reason of the disease by definition of academician Nesterov. In this case, we can identify risk factors and pathogenic factors, and interaction of the both formulate the stages of pathogenesis. Risk factors in medicine are the ones that could significantly increase the probability of the disease, but they are not the only reason of the disease. Pathogenic factor is actually the cause of this disease and gives it specific character. Glaucoma belongs to multifactorial group of diseases that is confirmed by the fact that there is no common etiological factor. There is very high prevalence of disease in the population, family-oriented, not meeting the monogenic types of heritage, presence of mixed and transition forms. In Helmholtz Institution, we performed epidemiological study that covered pretty large pool of patients. More than 12,000 patients were examined and enrolled into that assessment. And as a result of this epidemiological study, we found out that glaucoma progression was seen almost in 50% of cases. The average rate of progression of the disease is 1 stage per 7 years, and among patients with progression, 1 stage in 4 years. Statistically, the average progression rate is high in males than in females. What are the systemic and local risk factors for this disease that can be identified? Age and gender, race, heritage, specificity and anomaly of the eye structure, IOP, pathologies of endocrine and nervous system. We can identify risk factors of IOP rise. That is age, family history, race, atherosclerosis in the history, and short sight. Glaucomic optical neuropathy risk factors are the increase of IOP, vascular dysregulation, vasospasmus, female gender, and particular race belonging. Glaucoma is a disease that is associated with age. The prevalence of glaucoma of 80+ is more than 14%. How it can be explained? With age, we observe the progression loss of nerve fibers, and there is reduced tolerance of the optic nerve to the increase of IOP. Gender. Primary open-angle glaucoma is more frequently seen in females, and primary closed-angle glaucoma also in females, because in females we see more frequently vasospastic syndrome, although this issue is very disputable, and sometimes glaucoma of lower pressure also seen in females, but statistically in males we more frequently see pigment glaucoma. Race. If we look at the race risk factor, we can say that statistically African origin people have higher IOP. In Japanese, there is higher percentage of normal pressure glaucoma. Pseudo-exfoliative glaucoma could be seen in Scandinavian regions, pigment glaucoma in the white nations, and closure angle in Asian area. Family history. It was shown that from 20 to 50% of all patients with POAG do have some genetic predisposition. With that, the offsprings of patients with POAG have a risk 10 times higher versus average population. Clinical manifestations of glaucoma among relatives have similar features. Besides, primary glaucoma in each further generation is seen at earlier age and has more severe course. And this is how we see anticipation phenomenon. Refraction anomalies. In case of hypermetropia, there is increased risk of primary angle closure glaucoma. In myopia refraction, we see more frequently pigment glaucoma. In case of myopia, the optic nerve more sensitive to the rise of IOP, and the specificity of the nerve head and visual fields could mask some changes. The direct risk factor is IOP per se, increased IOP. Lability of and variability of IOP, daily variability. But nevertheless, we should not forget the following, that in 80% of people with increased IOP, there is no glaucoma development, no glaucoma optic neuropathy, although in 30% of patients with glaucoma, we do not see the increase of IOP. The retinal thickness, definitely one of the reasons of wrong and hyperdiagnosis of glaucoma or misdiagnosis is a thick retina. In case of thin retina, even normal figures of IOP can mask the features and the progression of normal pressure glaucoma. And here we have to be very cautious to the issues of diagnosis, complex diagnosis of glaucoma. IOP and refractional operations. We have to remember that after the refractional operations, the IOP data usually reduced from 2 to 4 millimeters. In such cases, pneumotonometric approach is more informative versus applanation, conventional type. And we should have basic knowledge, fundamental knowledge, baseline data before the refractions in order to have understanding on the pressure variability post-op. According to Felix Rogant's definition, which was given almost 200 years ago, he said that glaucoma eye is a sick eye in a sick organism. So very many studies were made with different scientific groups. And a number of the studies do confirm the link of glaucoma and some systemic changes. Some studies did not confirm that. Here on the slide you can see that currently it was found out that there is particular association of glaucoma with blood pressure, presence of vasospasms, vasospastic syndrome, with the presence of particular blood formula, the status of vegetative nervous system, and the presence of thyroid diseases in the history. Let's consider particular risk factors in detail. Until now, glaucoma pathogenesis is being studied, but not completely studied. It's very multifactorial. There are very many aspects that can influence the disease, starting with micro and macro elements, disbalance, protein disbalance, changes of activity of different enzymes, and some genetic changes. Studies that were performed in glaucoma department in Helmholtz Institution showed that in patients with glaucoma, we do observe non-specific dysplasia of connective tissue that could be seen in Stannick syndrome, almost in 80% of patients with primary glaucoma. Syndrome of hypermobility of joints, it's almost 90% of patients with glaucoma, vascular syndrome 46%, thoracidiaphragmal syndrome almost 40%. So these studies were made in complex, in cooperation with rheumatology institution. Also, we show that patients with glaucoma do have different problems with blood circulation more frequently versus healthy population of the same age. We do know that glaucoma patients, these are mainly aged patients, and atherosclerotic features are important mainly in this group. But nevertheless, the direct link between atherosclerosis and glaucoma has not yet been proved. Nevertheless, patients with glaucoma that have arterial hypertension and with poor correction of IOP can have nocturnal drops of IOP, which is very unfavorable for the glaucoma optic neuropathy development. So it emphasizes once again the fact that our patients do need really multidisciplinary approach in the diagnosis and treatment, and we have to work with GPs, cardiologists, endocrinologists. ECG changes that demonstrate particular segment depression, arrhythmias, including atrial fibrillation in patients with glaucoma, could be seen twice more frequently versus in a similar age group without glaucoma. Migraine could be seen in 28% of patients with normal pressure glaucoma and in 10% of primary open-angle glaucoma patients, POAG patients. Blood rheology, changing of blood formula, increased clotting, increased aggregation. It is seen more frequently in patients with normal pressure glaucoma. Organ tissue circulation is observed, like ischemia, venous hyperemia, In some recent years, you most probably read, and you do know, that currently there is a term, Flammer syndrome, that describes particular phenotype which is characterized the destruction of the primary vascular regulation. The main features of Flammer syndrome presented here: first of all, redistribution of blood temperature, cold extremities, upper and lower, reduced circulation after the cold provocation, changed gene expression in lymphocytes. In patients with glaucoma and Flammer syndrome, glaucoma is usually associated with the presence of hemorrhages in the optic nerve disc, increased venous pressure in the retinal vessels, and diffuse defects of the visual fields. The changes and lability of the vegetative nervous system is well known. Usually it's increased heart rate, dizziness, which is a result of cerebrovascular spasm. It leads to the disorder of adaptation to the environment and reduction of work efficiency. Definitely, as a risk factor for glaucoma, we can consider the immunocompromised status. It was shown that autoimmune processes development related to the disbalance between T and B lymphocytes, which is also seen in glaucoma. T lymphocytes level reduction and suppressor fraction is responsible for autoimmune diseases control, and as a result of that, in about 30% of glaucoma patients, normal pressure glaucoma, demonstrate multiple sclerosis, fibromyalgia, rheumatoid arthritis. Other risk factors is also related with endocrine system. The link of glaucoma and diabetes had been studied for many scientific groups, and it has been proved that the risk of glaucoma in diabetic patients is more than 30%, and it was shown in these particular studies like Rotterdam, Beaver Dam Eye, Blue Mountain Eye Study. Thyroid dysfunction, one more risk factor. In case of Graves' disease, glaucoma is related to several mechanisms that lead to increase of venous pressure in the episcleral veins, the reduced outflow, and fibrosis of extraocular muscles that increases compression for the orbit. and causes the development of compression neuroopticopathia that frequently complicates the interpretation of the examination results of visual field. Adenoma. Somatotropin level can influence the regulation through trabecula. There are particular observations that in the stimulation of the growth hormone via arginine, patients with glaucoma and the growth of growth hormone in plasma blood increase twice more frequently versus control group. So pituitary gland and adenoma of pituitary gland plays a crucial role here. So what combines glaucoma and neurodegenerative diseases like Alzheimer, Parkinson, Huntington, peak? So first of all, elderly age, long-standing latent phase, which is about 6 to 8 years. Some structural and functional changes in glaucoma could be seen not only at the level of ganglia of the optic nerve, but also in the visual cortex as well. So if it is proved that glaucoma belongs to neurodegenerative diseases, it will allow us to treat glaucoma versus similar rules as the similar group of diseases, neurodegenerative diseases. We can identify one more risk factor as apnoea, which is sleep disorder as a result of collapse of soft tissue of the posterior wall of the throat and larynx. As a result, we observe hypoxia that increases risk of cardiovascular and neurological disorders. The results of examinations of more than 1,000 elderly patients that were treated from very prevalent form of apnoea demonstrated the presence of almost 70% probability of glaucoma development within 5 next years after the making diagnosis of apnoea versus the control group. Empty Turkish saddle syndrome. This is sublacerated cistern into the cavity. And it gives clinical picture of headache, neuroendocrine disorder, typical feature and MRI and basal hemianopsia. So cellular fossa. If there is a syndrome of empty cellular fossa, in almost 26% of cases, it leads to the increased IOP. Deafness as a risk factor for glaucoma. It can be associated with microcirculation disorder, presence of vasospasm, and also the increased level of endothelin-1. Helicobacter pylori. This is bacteria which causes particular gastric infection, and it can be the trigger of the ulceration. But this bacteria can specifically be found in 2/3 residents of this planet. And the possible mechanism of pathogenesis in glaucoma is the influence of toxic agents of bacteria to the retina and to the optic nerve. Definitely, the risk factors should be the psychological aspects as well. They should not be forgotten, because glaucoma is actually a disease which is treated but incurable, treatable but incurable. So when we make this diagnosis to our patients appear to be in a very severe, serious psychological condition. And we have to understand that glaucoma leads to irreversible blindness. Is really very difficult to accept it and to understand it for our patients. From here, we face very many psychological problems, such as the reduced quality of life, the need of social support, the need of relative support and family support, increased risk of depressions, traumas, falls. It has been shown that in this particular group of patients, there is twice higher risk of premature death. So, concluding, I can say that glaucoma is a multifactorial disease with complex relations of IOP, vascular, immunological, and other systemic factors that lead to the destruction of optic nerve. Dear colleagues, I cannot help forgetting about one more important factor that is needed in glaucoma monitoring. This is compliance to treatment as the most important success factor for glaucoma treatment. Our patients are usually followed by several specialists because mainly in our patients pool, these are quite elderly patients. That means they are in polypragmasia situation, drug-drug interactions. So for us, it's very important that they set correct priorities in their treatment and do not refuse from our indications. Compliance to treatment, it's the adherence of patients' behavior to the recommendations of the doctor. It has been proved that almost 100% of doctors are absolutely sure that patients follow their recommendations, although in reality only less than 50 do perform these recommendations. So we need a system of partnership between the doctor and the patient. What compliance consists of? And this is Professor Alexeyev's work. Here we see that the fact that patients do not believe it is to be important to use eye drops because at the very early stages of the disease particular there is good visual acuity and patients does not feel any pain or discomfort. Some social aspects when patients cannot apply treatment on their own, or there is not enough financial support, or simply forgetful. They forget. So treatment efficacy is treatment is really effective when we have very simple regimen of treatment and we administer drugs that have minimum adverse reactions and affordable for the patients. And definitely we should provide our patients with complete information. They should be absolutely aware about the severe disease and very unfavorable outcomes if they do not stick to our recommendations. I would like to thank you for your attention, and I would like to thank my colleagues, the team of Glaucoma Department, Senior Research Fellow Yakubova Lydia, for the help in making this presentation. Thank you very much. Thank you very much, Olga. Thank you very much.